Several scientific studies suggest that people who have contracted COVID-19 are immune to it for at least 3 to 6 months after the infection. Now, the level of antibodies will vary from one patient to another depending on the severity of the infection that one has suffered. But even someone who's had a mild case of COVID-19 actually has somewhat of a memorized immune system response. And on the basis of that information, the High Health Authority here in France now recommends that people who have recovered from COVID-19 only get one shot of the vaccine, let it be by AstraZeneca, Moderna, or Pfizer, because the idea is simple. Those people already have somewhat of an immunity and antibodies, and one single shot will actually act as a booster. They recommend that the jab be given at least 3 months after the infection and ideally 6 months after the infection. Now, of course, there's the question of what happens to people who've had both shots and who have contracted COVID-19. Well, according to the High Health Authority here in France, they shouldn't, in principle, I quote, suffer any severe side effects. Now, there are two categories of people who aren't included in this one single shot protocol. Of course, people who are immunosuppressed, but also people who have contracted COVID-19 after receiving the first jab. They will have to get the second shot. Now, this strategy, of course, is to try to vaccinate as many people as possible.